My name is Maria Weiner, and I'm the president of Florida Caregivers Network. So I am so ready to start this day. I've been ready for the past 7 months.
So have we.
Yes, ma'am. Good morning, everyone, and welcome to the second annual Caregiver Conference, Getting Real About Reality. Today will be a special day for all the caregivers in this room and professionals that care or know someone that lives with dementia. I hope that by the end of this day, you guys are re-energized with all this information we're going to give you, have the tools, have all the resources for you to take care of your loved one. So we're going to start, and we're going to get real about reality.
I give you our next speaker, is Eileen Poiley.
Good afternoon. I haven't had a chance to look around to see if I recognize any faces. I do a lot of presentations throughout Tampa Bay area, so I'm sure somebody here has heard me talk before. So I'm very glad to have the opportunity to talk to everybody. Is everybody here a family caregiver, caring for somebody with Alzheimer's or dementia? Okay, well then usually this is a topic that a lot of people are looking forward to listening to, on dealing with behaviors. So first I want to talk about, do I advance these up here? Yes, I do. Okay, that's great. All right. So the first thing I want to talk about is I'm going to use the word Alzheimer's because it is the most common, but the first thing I want to talk about are the types of dementia. Most people just say, my mother has dementia, or they're not really sure. So I wanted to first go over very briefly that the main types of dementia. The word dementia itself is actually not a disease. So if a doctor has told you your loved one has dementia, you need to say, okay, what is causing that dementia? Because dementia itself is an umbrella term that is used to describe something that is causing memory problems, confusion, language problems, and there's many causes of dementia, some of which can actually be treated. So you may have someone in the early stages and they may actually have problems with their thyroid, a vitamin B12 deficiency. There may be an infection going on, medications. There may be other issues that are causing their memory problem that can actually be treated or improved. So the first thing is always make sure you know what's causing it and get a very good diagnosis. Once you know what's causing it, the most common cause of dementia is Alzheimer's disease, which is over about 60%, which is why people often use those words interchangeably. But they're actually, Alzheimer's is a cause of dementia, the most common cause. I'll go into Alzheimer's in more depth because that's probably what most of you are dealing with. But it is helpful if you know. Many years ago, it wasn't as much of a priority to know what type of dementia, but now we realize it's helpful for several reasons. One, getting that good diagnosis, make sure that you know what you're dealing with and there's nothing that can be treated that can improve the situation. Also, it's helpful to know because the medication may be slightly different depending on what type of dementia your loved one has, and the course of treatment is going to be different. The other thing as caregivers is the behaviors are going to be different. And it's a lot easier to deal with something when you know what it is you're dealing with. So it's really helpful. So I'm going to go into Alzheimer's in more detail in a minute. But the Lewy body dementia, if anybody here is dealing with Lewy body dementia, that's characterized by someone having very early hallucinations. So early in the disease process, they may see things or hear things that are very real to them, but not to you. That's what a hallucination is. Someone with Alzheimer's may get hallucinations, but if they do, typically they're later on in the disease process. They're going to have Parkinson-like symptoms. They may have trouble walking, they may have a stiff gait, they may have a little rigidity. So they often were misdiagnosed as having Parkinson's, but actually Lewy body dementia is different from Parkinson's disease. They also may have a fluctuation in their memory loss, where a person with Alzheimer's progresses on a pretty even rate of decline, where somebody with Lewy body dementia, they may have a good day, a bad day, they may progress more in a roller coaster where one day they may be a little more clear than the next day, which makes it difficult for a caregiver. The other thing that's not on there that I need to add is if you do have somebody you're dealing with Lewy body dementia, the most important thing is they're very, very sensitive to medications. And a lot of medications given to somebody with Lewy body dementia, instead of making them better, will make them worse. For instance, if you give somebody who has Alzheimer's disease an antipsychotic medication to help with some hallucinations, you have a choice of many different types of antipsychotics. However, most of those antipsychotics, if you give them to somebody with Lewy body dementia, you will increase confusion. If somebody with any type of dementia has a urinary tract infection, that will increase their confusion, and the medication for someone with Lewy body will make it even worse. If they're given medication for incontinence, it will make it worse. So you really need to be very careful. The one medication that we really say that anyone should stay away from with dementia is sleep aids, taking Benadryl to sleep, Tylenol PM. Those medications are not advised for somebody with Alzheimer's, especially somebody with Lewy body. It will increase confusion. Vascular dementia is caused by mini strokes. So if someone has had mini strokes, you will notice that they're going to get vascular dementia. So you'll see more of a stair-step decline, and they may lose specific areas of cognition depending on where they have the mini stroke. So for someone with vascular dementia, you're going to want to monitor their blood pressure, monitor their salt intake, and monitor to prevent future strokes. We often see mixed dementia, which is a combination of vascular dementia and Alzheimer's disease. The last one, does anybody here have a loved one with frontal temporal dementia? I see a few hands. A lot of people think, oh, well, it's not Alzheimer's disease. Well, frontal temporal disease is very different because the first problem is typically not memory. Memory loss is not the first concern. Frontal temporal dementia affects the frontal lobe, which is the part of your brain that tells you what is appropriate behavior and not. It also is a part of your brain that controls impulses, personality. So somebody with frontal temporal dementia may not have the same level of memory problems for a long time. However, they may say things that are very inappropriate. They may do things that are very inappropriate. It may be grandma who never said a cuss word her entire life, and now that's all she's saying, because that part of her brain that knows what is appropriate does not work anymore. You may get an aide that comes in and your mother now wants to tell the aide she's fat. You know, they may say things that you're so upset that are rude, but they don't know that what they're saying is inappropriate. They may go into a store and steal something or take things. They may, I had one scenario where the gentleman was following a little girl around in Publix. He thought she was cute and reminded him of his granddaughter. Well, in today's society, an older gentleman following a little girl is probably not a good thing. He wasn't doing it with any intentions. He didn't know what he was doing was inappropriate. So frontal temporal dementia is very different and also extremely difficult for those caregivers. So it definitely helps so you know what you're going to be dealing with. But I'm going to be talking mostly about Alzheimer's disease, and the memory issues and behavior management strategies really work no matter what type of dementia that you're dealing with. So people ask me what I do. When I tell them I work with Alzheimer's, most people say, oh, isn't that the disease where you forget things? Well, those of you who have been doing this for years and you've been caregiving for years, you know by now that it's much more than just memory, that it's a lot of cognitive losses beyond memory. So in order to learn how to communicate effectively with someone and how to manage behaviors, you really need to know what the cognitive losses are that your loved one is dealing with and what this disease causes, and you need to know how the patient experiences these losses. So, let me go over some of the cognitive losses so you really can understand what your loved one is dealing with. Before I explain these, If I were to say to you that there's a group in the other room and I want you to go in and I want you to talk to that group, what would you want to know? Who are they? Okay, if I told you it's either a group of teenagers, toddlers, or seniors, would you adjust how you talk to that group? Yes, okay. So you already realize that depending on who it is you're talking to, you will make definite differences in how you interact. So what I want to explain to you now is a different audience. And the audience that now I'm going to explain that you're going to interact with is the person with Alzheimer's. And to really let you understand more about what they're dealing with so you can better interact with them. So if you look at the list, and this is only the first part of the list, this is not all of them. These are the cognitive losses that a person with Alzheimer's will lose. Now, the one thing we say is once you've met one person with Alzheimer's, you've only met one. So if you have a loved one and you go to a support group and you're in your first year and they're 5 years down the road, don't think your situation is always going to mirror theirs. Everybody goes through this very, very differently. So these are some of the cognitive losses: logical thinking, problem solving, reasoning, learning, abstract thinking, memory, decision making, comprehension. And you think, okay, that is a very long list, but how does that affect their behaviors? All right, has anybody here been accused of stealing something from your loved one? Right? I see head shaking, hands up. That's very common, and there's several reasons. All right, let's say you leave here today and you're going home, and as soon as you get to your house, you get out of your car and you dump your keys back in and you go up, and then you realize nobody else is home. So now you got to reach for your keys to open the door, and you hear the phone ringing inside. So as soon as you get inside, you immediately go to the first room in the guest room, put your keys down, put your purse down, and answer the phone. About 3 hours later, you're in the kitchen, you realize you need to go to the store to get something for dinner, and you think to yourself, where are my keys? Where's my phone? Where's my purse? Where is everything? At that moment, your brain goes through a process so quickly you don't always realize it. First is you use your reasoning and logical thinking, and you say to yourself, nobody was home when I got home, therefore I know for a fact I was the one who opened the door, therefore my keys and everything must be in the house. Then I'm going to use my problem-solving skills to figure out where in the house I might have put them. Oh, that's right, I'm going to use my short-term memory. My short-term memory tells me when I came in, the phone was ringing. I went into the first room. I will then retrace my steps. You go into that room, and sure enough, sitting on the bed, there are your keys and your purse. And you can find something. Now, if you no longer have reasoning, thinking, logic, short-term memory, or problem-solving skills like a person with Alzheimer's disease, how are they supposed to find things? They can't. So the first person who walks in the room must have taken it, and that may be you. So their accusing you has nothing to do with you. It has to do with the fact that they no longer have any other means of finding things that you typically would. They may say they left their keys somewhere during the day, not realizing that they had to open up the door. So oftentimes their reason for looking for accusing you is merely because they don't know where it is. You may have lost your cell phone, and you may say, you know what, I lost my cell phone last week and I still can't find it. And you're trying to stop and think, okay, the last time I had it, I was making a call, and you sit there and you go through this process to find things. You may not always find them, but you go through a process of trying to remember the last time you had it, using your short-term memory. All those things are gone. So yes, they're going to accuse you of taking things, or of moving things, of hiding things. Abstract thinking, memory, they have short-term memory loss. So they absolutely can't remember things. So if you say to somebody, I have to go to the store, I'll be back in a few minutes, and you come back and they say, where did you go? You say, well, I told you I was going to the store. Yes, in your world you may have told them, but they don't have the ability to save information. So when I would have a conversation, I could say, hey, Peg, we should get together and have lunch next week. Okay, We both put that fact into our brain, we pick a date, and we mark it in our brain. That conversation gets inserted into the part of the brain that can hold memory short term until both of us can get to a calendar to write it down. The person with Alzheimer's disease will say, okay, that sounds great, let's have lunch. When they go to insert that information in their brain, that part of their brain is shut, and that conversation falls to the ground. So you can tell them you're going to the store, but then when they're sitting there by themselves and they're looking for you, if they open up their brain, the sentence that said, I'm going to the store, was never inserted in their brain because they can't save new memory. It's on the floor somewhere, it's gone. So they can't remember that you told them. So yes, they're going to ask you something over and over and over because they have no way of remembering it each time you tell them. Decision making, they can't make a decision. You could tell them to pick out clothing, where do you want to go, do you want some coffee or tea? Sometimes making a decision can be extremely difficult. Comprehension, they may not understand, they will not understand the world as you understand it. They will not understand when they're watching TV and what they're hearing. They're going to hear something on TV and there may be a rash of robberies in downtown Clearwater, and then they're going to hear noise in their attic and there's the person there. They may hear bits and pieces of one news show and another news show, and in one news show they're trying to do something with recycling because plastic is a problem in this country. They're going to hear another news show, we shouldn't drink from this. They're going to put a fact from this and a fact from this and tell you we can't have plastic ever again. I had a caregiver said that, well, what do you serve? Everything we have is plastic. Because they're going to take a piece of fact and a piece of information and they will jumble things up. They will misunderstand what they're watching. They'll misunderstand conversations of what they're hearing. Parts of their brain can't process things. So they may be watching something on TV that there's flooding in Arizona and they're in the other room packing because they think they need to evacuate, because they don't understand and comprehend the way you can. So imagine living in a world when it's very difficult to comprehend the world around you anymore. Some other cognitive loss, cause and effect. You understand if you do something, the effect it's going to have. You understand putting your hand down the garbage disposal to dislodge something, it better be turned off because you understand cause and effect. You understand if you put the water on and you stop it with clothes, what the effect is going to be. Cause and effect is a cognitive skill that they may not be able to remember. So keeping them safe in the house when they may not know the safety features of things is very important. They're not going to have good judgment. They're going to have problems with language. They lose vocabulary. So you need to be aware and keep your conversation very short, simple sentences because they're going to be losing vocabulary and the ability to comprehend what you're saying. They'll have trouble coming up with words. We don't look at sequencing as a cognitive skill, but sequencing it's the order of how you get dressed, it's the order of how you shave, the order of how you cook, how you brush your teeth. Everything you do has a particular order. So if you say to your loved one, why don't you go get dressed, and they stand there, or the woman comes out with her bra over her clothes, and you think to yourself, what in the world is she doing? That is a sequencing issue. They don't know the order of things, or they may not be able to look at all the clothing option and determine what to wear anymore. I had a caregiver in one of my support groups, patient support group. She is 60 years old, has Alzheimer's, and she said one of the early signs that she knew something was not right was that she was always, and still is, very, very well dressed. Jacket, sweater, scarf, always very well dressed. She said she'd go into the room and her husband would say what they were doing and she wouldn't know what to get dressed. If I were to say to you, it's July in Florida, let's go on a picnic, you would know immediately wear something very light because it's going to be very hot, and a picnic so it's casual. So you would immediately know what to wear. She said those clues didn't mean anything to her anymore, and she would go into her closet and she would see all these clothing options and all these pants and all these skirts and all these blouses, and she didn't know what to do. She said she could no longer make the decision, the judgment, knowing the order. She was just stuck. So she actually is very aware of her deficits, which is very unusual. And she had her daughter clean out her closet. And she said now when she goes in her closet, she has 12 hangers. And each hanger is the pants, the jacket, the scarf, the jewelry, is a complete outfit. And he keeps the outfits based on the weather. So she can just go in and grab an outfit, grab a hanger, and she's ready to go. So not everyone can see what their problem is. Orientation to time and space. Orientation to space, we often think of wandering as getting lost somewhere, but wandering can be as simple as being in this room. You could put somebody with Alzheimer's in the middle of this room and watch them get disoriented because are those windows, are those doors, there's a door, there's a door, there's a door, all these doors, and they wouldn't know where to go. So it's a disorientation to the space around them. It's not necessarily that they're off wandering to get out somewhere. They can be very easily confused in a space. We oftentimes in our home where you go to visit people, we tend to keep bathroom doors closed. So there's a bathroom door, a linen closet door, a guest bedroom door, all these doors, and you wonder why they can't always find the bathroom. Put a bathroom sign and a picture of a toilet on the bathroom and leave it open. You know, they see all those doors, they're going to get confused. Orientation to time. I could say to you, I will be back in 30 minutes. And if I'm back in 30 minutes, you will be pleased. If I'm back in 40, you may say, oh, what happened? You're a little late. If I'm back early, you'll be pleased. A person with Alzheimer's at some point loses the concept of time. And if you say I'm going to be back in 30 minutes doesn't mean 30 minutes to them. They don't know what the passing of time is anymore. You may come back thinking, oh, I'm back and it's only 25 minutes, great. And they're in there crying. So what's the matter? Well, you left me here all day. I've been so worried. Where did you go? Also using time as a problem. I had a caregiver who pulled up into a strip center and right in front of a CVS told her husband who had Alzheimer's, I'm going to go in, grab our medicine, I'll come right back, I'll be gone 10 minutes, just wait here. She came back, he was gone. An hour went by before she finally found him. She went back in the store to see if he went back in there. He didn't. Finally, she went back and forth in all the stores along the strip center, finally found him at the other end of the strip center. She was almost in hysterics. His reaction, oh, I was so worried. You were lost. You were gone for hours. I had to go look for you. So you be careful using the concept. Don't use the concept of time. Instead, your goal is for them to know you're coming back. So rather than say, I'm going to be gone for 30 minutes, say, I have to go to the store to get milk for both of us, but don't you worry, I will be back for you. I always will be back. They're still going to probably get upset thinking, why did you leave so long? But don't put the concept of time because it can tend to be more of a problem than a help. All right. Some of the assumptions that we have to make sure we're not making, they're not doing these behaviors intentionally. Sometimes you think, oh my gosh, they're just doing this to get my attention. Unless they're in the very, very early stages and very, very smart, I wouldn't even think that. Another problem with Alzheimer's, if you had a friend who broke their leg, you're not going to ask them to go on a hike. If you have someone with advanced Parkinson's, you're not going to ask them to go on a hike because you can see what their problem is and you can immediately see their limitations. The problem we have with Alzheimer's is that you can't see it. And oftentimes, they have no other health problems. So you have somebody who really looks very good. And your family and friends who don't see your loved one often will say, well, I don't see anything wrong. Mom looks great, or she looks great to me. Well, live in my shoes for a weekend, and then we'll talk, is usually what caregivers can say. But they don't always look like they have a problem. You can't see brain cells dying. You can't see atrophy. So sometimes it can be very frustrating when they don't look, quote, like they're sick or there's a problem. And therefore, we oftentimes don't realize that we think they're not trying, but they are. All right. So there's two kinds of behaviors that we deal with. There's primary behaviors, and then there's more of the secondary or the difficult behaviors. The primary behaviors are the ones that most people will experience at different levels. Some will get more focused on one area than another. But I want to spend more time on the difficult ones. I'm just going to make comments on some of these. Memory loss, these are not only are these the primary behaviors, these are also warning signs. So if you see some of these symptoms in somebody, these are warning signs as well as the behaviors you'll see when someone has Alzheimer's. So you're going to see problems with memory. You're going to see short-term memory loss. You're going to know that they're going to repeat questions and tell you the same stories over and over. You'll see problems with language and word finding. Not only misplacing objects, but maybe putting them in unusual places. You may find silverware in the refrigerator, the milk in the cabinet, clothing in the wrong places. You know, they're going to put things in not necessarily where they belong. Difficulty performing tasks, whether it be the standard tasks that they were always doing, cooking, dressing, doing laundry. They may be some simple tasks, tying their shoes, playing cards, doing more difficult tasks. They're having company for the holidays, and Mom normally was able to put on this wonderful spread, and we just noticed all sorts of problems this year. Orientation, I said, to time and space, poor judgment, problems with mental tasks. You may start seeing that they're having difficulty with their finances, balancing checkbooks, writing checks, making decisions. They're not reading mail and processing things the right way. You may see changes in their mood and personality, and they're going to get more dependent on a primary caregiver. Now, the behaviors that I want to talk a little bit more about are difficult behaviors, and these are the behaviors that are the most troublesome for caregivers. So the first two I want to talk about is agitation and aggression. Agitation and aggression are similar in that they're both physical or verbal. They're different in the level. Agitation is when they're just maybe agitated, they're needing to walk, they're wandering, they're pacing, they're upset, they're antsy. Something's bothering them, something that they can't necessarily express to you is upsetting them, they're not comprehending something is just not right. It could be something simple to something much more complex, but something already is making them agitated. Aggressive behavior is when the agitation gets hostile or more verbal. So now they may be hitting as opposed to just complaining. Now they may be more pushing, scratching, kicking, hitting, more verbal, threatening, name calling. So it's much more difficult. Now, a lot of times people will ask me if their loved one is in the stage of the disease that causes aggression. And there's not necessarily a stage, and not everybody goes through aggressive behavior. What you really want to try and learn to do is to figure out what causes your loved one to become agitated. Think of, when something is bothering you, you tend to express it verbally. They don't have that ability. So the first thing you have to remember is when something is not right, their way of expressing it is going to be through behaviors. So when they're starting to get agitated, it could be they're scared, they're lonely, they're bored, they're upset, they're hot, they're cold, they're hungry, they're in pain, they're lost. It could be a multitude of emotions or feelings that they're not really sure, but they're not calm. There's some stress going on, and they're causing that agitation. It could be the environment that they're in that could be overwhelming, or it could be how people are interacting. Now, I know caregivers are always doing their best, but sometimes what we don't realize is our own interaction can cause somebody to become aggressive. And I'll give you an example of a caregiver who I was working with at one of my support groups. Told me that she moved her mother in with her, and by the end of the evening, her mother was threatening to kill her. And she was very, very, very upset. And she said that they always had a wonderful relationship, so it wasn't like there was this big problem now with her mother. but she just didn't know what to do. So I said, well, describe your day to me and let me see what's going on. She said, we would get up at 8 o'clock. I would ask my mother what she wants for breakfast, whatever she wants. If she wants to eat outside, in the kitchen, wherever, I would do whatever she wants, and breakfast would go over fine, and Mom was always happy. She said, then about 10:30, she would start in on me. Well, when are we going to eat? You haven't fed me. I haven't eaten anything. And I would have to remind her, you wanted eggs, we had eggs and toast, and you had your coffee, we were sitting out on the patio. Don't you remember you were looking at the neighbor's dog? I said, you'll be fine, we'll eat an early lunch, but you'll be fine. And she seems to be all huffy with me. She said, then we have lunch at noon, and she's happy again. She eats lunch, she's perfectly happy, everything is fine through lunch. Then at about 3 o'clock, she starts in on me again. I haven't eaten all day. Why don't you feed me? We haven't had anything to eat. And I have to remind her again what she had for breakfast, remind her again what she had for lunch. This happens again after dinner, and then before we go to bed, I have to take a good half an hour or 45 minutes to get her out of her clothes and into her pajamas, and she gets so angry, that's when she starts to threaten me. I said, okay, well, let's look at the day. And if you remember nothing else on behavior management, the thing you need to remember is that there's two realities. There's your reality, and then there's the Alzheimer's reality. And you need to learn to live in the Alzheimer's reality, because that's what caused this mother to get so agitated. I said, okay, at 8 o'clock, your reality says we're eating breakfast, and your mother's reality said we're eating breakfast. Everybody was happy. At 10 o'clock, your reality says, I still have short-term memory, so I remember we ate breakfast 2 hours ago. Your mother's reality says, I have no short-term memory, I don't remember breakfast, therefore I didn't eat. They don't have the same feeling of hunger, so they don't have the ability to say, gee, you know what, I'm not hungry, so maybe you're right. No, in her reality, the Alzheimer's reality, it's quite simple. I didn't eat, don't remember breakfast, you didn't feed me. You can't sit there. What the daughter was trying to do was jog her memory. Yes, I could jog your memory and say, remember that restaurant we ate at the beach, and remember that was the day we got to watch that wedding, and then it started to rain, and I could say enough clues that eventually you're going to say, oh yeah, oh gosh, it's been so long, now I remember. Can't do that with Alzheimer's. It was never saved. She ate breakfast, she enjoyed breakfast, breakfast ended, gone. No memory saved, period. So at 10 o'clock, Mom does not know breakfast ever happened. So what is the daughter doing? The daughter is trying to convince Mom it did. Mom, we ate breakfast. Mom, we ate out back. Mom, don't you remember? How would you like if I sat here and said, I really like your pink and blue polka dot shirt, and I'm not going to stop until you agree with me that it's pink polka dots? That's really what you're doing. You're making them agree with something that in their world is not true. That would make anybody angry. So you're making them angry. Then after lunch, 3 o'clock rolled around, the same thing happened. The daughter tried to remind the mother about breakfast, remind her about lunch, and she's making her mother angry because her mother has no memory of those things happening. And that happened again after dinner. Then we get to bedtime, okay? You're not going to get up tomorrow and wear that exact outfit. And you probably aren't going to sleep in that outfit, because in our reality, we have a variety of clothes, and we like wearing different things every day. We also have daytime clothes, and we have nighttime clothes. All right, what's the reality of clothes for Alzheimer's? What? Whatever, right? What they have on. If they happen to like the color red, and they're wearing a red shirt that they like, they'll be happy to wear that same red shirt every single day. And if they really like it, nice and comfy, they'll be very happy sleeping in it. So think of the mother's reality. You're trying to take clothes off of me that I really like, that are really comfortable, to put on clothes that you deem appropriate for sleeping, when I'm already in my clothes I want to sleep in. So what you've done is throughout the day correcting the mother. I said all you're doing throughout the day is creating stress on top of stress on top of stress on top of stress. You're never giving her any type of reinforcement of anything she's doing right. You're constantly telling her she's wrong. You're constantly correcting her. Even if she doesn't remember the little arguments, you're still creating stress throughout the day. I said, why don't you try living in your mother's reality? So at 8 o'clock, give her half a breakfast. At 10 o'clock, when she says to you, we haven't eaten breakfast, you can say, you know, right? You are right, Mom. I am so glad you said something. Let's eat. No argument. Now you give her the other half. So now she's going to eat 6 small meals a day. And if it needs to be more, then it doesn't have to be a sit-down meal. As long as she's eating snacks throughout the day that are healthy snacks that combined fill the nutrition for a day, then that's what you want. So that way now you're not arguing with her. And I told the daughter, you have a choice at night. You can either fight for 30 minutes to get her out of her red outfit that she loves, to put her in clothes that you deem appropriate. So you've taken 30 minutes to fight with her, so she's going to get angry. Or you can take that same 30 minutes and do something with quality of that improves her quality of life and makes you both happy. Get out a prayer book and sing some prayers if she was religious. Go sing, put on some music, eat cookies. What Alzheimer's person doesn't like cookies? Do something that's going to give quality of life and let them sleep in whatever they're sleeping in. Once the daughter learned to live in her mother's reality, all the threats and all the behaviors went away. Now, it's not always quite so simple. I'm not saying it is. But that is a perfect example of how best intentions were actually causing her to go from being agitated to being aggressive. Just by trying, the daughter thought she was trying to keep her mother in the reality that's the correct reality, thinking it's not going to progress the disease, but we know that's not true. So, the next two I want to talk about are hallucinations and delusions. Hallucinations involves the senses when they see something, hear something, feel something that in their mind is real. You may not see the little kids in the room, but they do. So again, the same thing as what I just said before. Don't try and say to them, if you come in the room and start talking and they say, I can't hear you, there's all these kids in the room, it's too much noise. Rather than saying, oh no, there's nobody else in the room but us, you're better off joining their hallucination, joining their reality, and dealing with it. And say, you know what, are you tired of all the noise? How about if I tell the kids they need to leave, and then you and I can go in the other room where it's quiet? You will do much better joining their reality and accepting their hallucination and realizing that their hallucination is causing them to be upset. Your first reaction needs to be to deal with their emotion. I see that you're very upset. That's validating to somebody. I see you're upset, and I see the kids are really bothering you. Let's go in the other room and then say, I'm going to go tell the kids to leave. And literally open up the door and say, okay, kids, it's time to go. We need some quiet. All right, thank you. We'll see you soon. You'll do much better dealing with their hallucination than trying to convince them it doesn't exist. Delusions is a belief in something that's not true. So delusions, there's many kinds of delusions. Some delusions can be a delusion that there's nothing you can do because it happens to be because of the disease. I had siblings that are caring for their 85-year-old mother. They're both in their early 60s, brother and sister. And the mother was still able to go back and forth between the two homes. Things were going along wonderfully. Mom got along with both of her son-in-law and daughter-in-law. Her husband had been deceased for years, and it was actually working well till they came to one of the support groups and said that Mom is becoming very inappropriate with her adult son, and she wants to sleep with him. She no longer likes the daughter-in-law. She wants her out. And I said, well, does she realize that, and she's calling him now by the name of her husband instead of the son. I said, does she recognize herself in the mirror? No. I said, does she probably not see herself as 85-year-old woman? I said, what does the adult son who is 60 look like compared to the father at that same age? And they said that they could have been twins. So she was now thinking she was younger, and she thought her adult son was her husband. So yes, she was going to sleep in the bedroom with her husband, and the daughter-in-law has now become the other woman. So in that sense, there was not much you could do. They moved her with the daughter because it just didn't work. But there's some that they will misunderstand simple everyday things you do. For example, I had one caregiver who her husband accused her, he had Alzheimer's, accused her of having an affair with the mailman. She knew what time he was coming every day. She went outside to greet him every morning. And every time he comes to the house to visit you, he brings you presents. You know, yes, we can chuckle, but it shows you that they don't put together the pieces of everyday things and they will misinterpret it. You could have somebody, how many of you have a loved one in a facility? I get a comment quite often in facilities that, oh, the people here steal from me all day. Let's say your mother's in an assisted living facility and she's decided she didn't want to go to the dining room. She's in her room that day. Dietary comes in, they bring her food. Half an hour later they come back and they say to her, oh, are you done eating? You want us to take your tray? And they take the tray, they leave the coffee cup. A little while later, housekeeping comes in and they take her trash can. Then a little while later, they come back in. Are you done your coffee? Can I take your cup for you? Then they come in and she's watching TV, so not to disturb her, laundry services quietly comes in, opens her closet and takes her clothes. And then they come back later and they take her water. And this goes on throughout the day. And then you come to visit, it's 5, 6 o'clock. So Mom, how's everything? They steal from me all day long. Well, not only do they steal, but we don't even realize it. Even if your loved one is at home and they're sitting in the family room and they still have their slippers, they have a sweater and the paper and their cup, and you walk over to them, oh, can I take your cup? Are you done? Oh, can I take your sweater? Are you okay now? We use the word take all the time. So what do you say? You're saying to them, can I take your stuff? Can I take your stuff? Can I take your stuff? Then what are they interpreting that as? Someone is taking my things and stealing from me all day. They don't realize when you're cleaning up and just taking something, cleaning it, putting it away, what you're doing. In their mind, you're asking to take it, you're taking it, they don't see it anymore, so you stole it. So you need to be very aware of the simple everyday things, how easily they can be misunderstood. Especially I've had some people who hire home health and they try and clean up throughout the day and take the person's things throughout the day, and then one of them literally was nice enough to take the white trash bag and take it to go outside. Well, the person thought they were stealing all their things in a bag and leaving with them. So you need to be very aware that they will process the everyday things you do very differently. They'll take little pieces of it and then just misunderstand it. You may be thinking you're being very nice, not disturbing them while they're watching TV, so you're going to tiptoe in quietly and take the clothes. That can be very easily misunderstood. So rather than say, can I take your cup? Oh, I see your coffee's gone. How about if I wash this mug and put it back in the kitchen so you can use it again? I bet you if you try and quickly say something, it's going to take you a little while to come up with a sentence that doesn't have the word take in it. I'm getting better. So you need to be aware of the hallucinations and the delusions. If you have a loved one who is prone to hallucinations or delusions, limit their TV watching. Because if they hear on the news that there's been a rash of robberies and they hear noise in their attic, that robber is living upstairs. So if they have the potential for to have a hallucination or delusion, you really want to be careful what they watch, because they often don't understand what they watch and will misinterpret it. Paranoia is when they can blame people. I had someone who they turned around and put sugar in their loved one's coffee and then turned around and handed it to them. They thought it was poisoning them. If they hear people whispering, they may misinterpret you're whispering about them. They're going to get very paranoid because they're not always understanding what's going on. So yes, they will be paranoid. So you need to be very careful that even though you don't think they understand, be aware when you're speaking about them in their presence and whispering, if they hear you but can't hear what you're saying, how they may be interpreting it. Illusions are different than hallucinations. A hallucination is if I see animals in the room and you all know that there are none. An illusion is similar, think of a magician. An illusion is when there is actually an object. So there is a tree over there, and you and I see it as a tree. But the person with Alzheimer's disease may see the shadow of a big face and it may be fearful. You may see pictures in a hallway that are abstract as abstract art. They may find them fearful. You may see a black mat on a floor and say, oh, that's a black mat. Some Alzheimer's individuals will see that as a hole. Grid lines on a floor may be very disconcerting to someone with Alzheimer's disease. A very shiny, wet tile they may perceive as wet. So they may misinterpret things that are there, but they may not see them the same as you or I. All right, so when you give medications, you really want to be very, very careful in giving medications for some of these difficult behaviors. If you notice a sudden change in your loved one, like they've been doing pretty good, and all of a sudden this week you're noticing a lot of difficult behaviors, always look for medical problems, because they may not tell you that they're having pain during urination or that they're constipated or their hip hurts. So they may not be able to verbalize it, but they may be able to show you through behaviors. I had a caregiver who every time they brought her mother to the table to eat, she would scream and throw fits and wouldn't sit down, till eventually they finally found out she actually needed a root canal. That the minute that she saw food, she knew it was going to be painful to eat. But she didn't say, hey, it hurts every time I chew. So don't always wait for them to express pain to you. So if you see a sudden change in behavior, always look to make sure there's nothing medical going on that needs to be treated. If it's not anything medical, you really want to try your best to deal with the behaviors without medication to the best of your ability first, because any antipsychotic medication that you're going to give them for hallucinations or delusions or behaviors is going to have side effects. And there's not always that exact amount where they can say, well, we'll make your mom just perfect. Sometimes they may be a little lethargic and they may have other problems. So you really want to use that as your last resort, not your first. All right, understanding the Alzheimer's reality, understanding that they have short-term memory loss and they do not remember things, so they do live in the moment. Understanding that they comprehend the world differently and they will take things that they read. They may read part of something on a paper and something they hear of one conversation, or they may be around you with a group of people and hear a sentence from here and a sentence from here and misunderstand things. So you need to really learn to join their reality and not correct their reality. Some of the challenges, obviously, you need to think quick. You need to be creative sometimes. You need a lot of patience. I know that. Sometimes you have to think before you speak. You don't want to always, I told you that, or I'm sorry, I forgot. I thought I told you that we had a doctor's appointment. Sometimes you have to just realize it's easier to validate and go along with them. Or if they say, no, we have to go, I have a doctor's appointment, and it's not till next week, you say, oh, okay. Go in the other room and call the phone with or call the doctor's office and say, oh, I want to see what time our appointment is. We know we have one today. And pretend you're talking. You don't have to call anyone. Just push a few numbers and say, oh, yeah, I'm calling because I know we have a doctor's appointment. We just need to confirm the time. Oh, you were ready to call us. The doctor's sick today. You need to reschedule. Oh, okay. Oh, you're glad I called. Well, thank you. I'm so glad I called. Okay, then you turn around to your spouse. You were right. We did have an appointment, but the doctor's sick, so we are going to reschedule. But thanks for having me call because we did have that appointment. So you validated them, but you know what you're doing. You're doing a creative way of getting around the problem. Some of the challenges, that they can't save memories. They live in the moment. So if you do something and plan a nice day and you take them out to lunch and you have a wonderful visit, and then you go back later that night and they say, oh, I haven't seen you in days. And you think to yourself, well, gee, why did I bother visiting you today? You can't go there because in our mind, we define success as looking forward to something, enjoying it, and then reliving it and remembering it. You have to remember they live in the moment. If you had lunch with mom and lunch was lovely, that's a success. It doesn't mean mom has to remember it later that night. So later that night when she says, oh, I haven't seen you in days, you say, well, I'm here right now because I missed you. There's no point in trying to sit there and say, Mom, I was just here. Mom, don't you remember? There's no point. You remember, you know that she had a good moment because that's your goal. Your goal is to maximize the moments, not make them remember the moments. Some of the behavior management techniques, I think I'm running out of time, so I'll just go over just the few that I haven't mentioned. Routine and schedule obviously is very good. I talked about behaviors are a sign, and you have to learn to enter their reality. Look how they're seeing the world. How confused are they? Do they, being in a place where nothing looks familiar to you, how scary that must be. Therapeutic fibbing, if somebody asks you, that they think that their mother is alive or they think something, rather than say, oh no, we can't visit your mother died years ago. Sometimes that bad news can make them cry and start to mourn. So therapeutic fibbing is when you're not lying, because lying means to do something with negative intentions. Therapeutic fibbing would be, well, I know you want to see your mother, and I know your mother always loves to see you, but she can't see you right now, she's away. But I know as soon as she's able, she's going to want to see you. And then immediately redirect them into something else. So you're not saying, really, you're being kind of evasive, but you're not telling them news that they can't handle. Looking beyond the obvious, don't always assume what you think something is when you're dealing with Alzheimer's. I had a caregiver whose husband loved to take walks and was always happy when they were walking and was immediately upset and scared when they came in the house. And she thought that he just preferred to be outdoors over indoors. It turned out he no longer recognized himself in the mirror, which about 50% of Alzheimer patients no longer recognize themselves. And every time he walked back in the house, they had a big mirror in the foyer, and there was that stranger waiting for him, and he was always scared that that man was in their house. So look around the house and be careful that you don't have a lot of mirrors, especially if your loved one no longer knows who that reflection is. Responding to the emotion, always start with, I see that upsets you. Respond to their emotion. They're upset and they need to be validated. They don't need to be reminded of their deficit. Some of the communication ones I've talked about, you don't want to argue or correct and telling them I told you something. Don't always ask them. If your grandchildren come to visit, don't say, oh, look, Mom, who's this? You remember who this is? Just tell them. You don't try and quiz them. You want to keep your sentences very simple choice of words, repeat the same words over, giving them time to process what you're saying. Their brain processes slower. Reminding them who people are. Always offer them reassurance. Even if they're in a facility, oh, Mom, this is where you live, you're in the right place, you're always doing the right thing. Everybody here is so happy to have you here, so happy to care for you. Because if nothing looks familiar, they might always be wondering if they need to go somewhere. That's why they may ask to go home, because home is familiar, and they don't always know that where they're at is familiar. And last thing is questioning. Keep your questions simple. Don't always ask an open-ended question. So, what did you do today? What do you want to do? That's a very difficult question. Either use multiple choice or a yes-no question. Or sometimes if you're looking for conversation, we always tend to have questions in our conversation. And, that's often difficult if you go out with friends and people always want to say, so, what are your kids up to? What are your grandchildren up to? Do you have any plans? Those are very difficult. Either talk about the present if you're out to eat. Talk about the restaurant. This is a really pretty place. I really like my food. Talk about the here and now, or just throw out a compliment. I really like your outfit. You look really nice today. It's always so nice to see you. And just throw out a compliment, and that's the easiest thing to process. And the last thing before I leave is take care of yourself. You're a better caregiver if you're in better condition. If any of you have flown on an airplane, they always say, put your oxygen on yourself first, and that way you are in better shape to take care of somebody else. So, raise your right hand if you are a caregiver. Turn it around and pat yourself on the back. And do this often. Thank you. I did bring some handouts on cards. I'll put them out on the table here, or wherever you want me to put them, over there. And I have another little card that says, my loved one has memory impairment. Please be patient and overlook behaviors that may be out of the ordinary. Or you can contact me if you want a copy of the PowerPoint or any other information. Thank you. Sorry.
Thank you, Eileen. Well,